So why do some people infected with the green flu virus turn into common infected and others turn into this guy? It may have to do with pre-existing diseases the person may have been suffering from before they were infected by the green flu. For example, the boomer appears to be someone who is suffering from morbid obesity. For their primary attack, boomers launch a volley of bile over a short distance. Any survivors hit by this bile instantly attract the attention of any nearby common infected, as well as summoning a horde of common infected, resulting in the survivor being swarmed. Their survivor's vision is also temporarily obscured by the boomer bile. This causes disorientation and makes it difficult for survivors hit with bile to rescue their fellow survivors who become pinned, as they may not realize they're in trouble. Bile is not just a substance created by boomers. It's actually a normal product of the human body created by the liver and stored in the gallbladder. It's then released into the GI tract via the bile duct, where it serves a key role in digestion, especially in the breakdown of fatty foods. The boomer is morbidly obese, so they were someone who ate a good amount of fatty foods, and their bodies probably produced a large amount of bile to help break down those foods. That explains why the boomer seems to be filled with bile, but why are they able to projectile vomit this bile? When someone has a bowel obstruction, they often begin to vomit bile. This is because the liver is constantly producing bile. If someone has an obstruction of their bowel, the bile can't flow in its normal pathway, and so it has to go somewhere. And so people tend to vomit it up. Another clue that the boomer may be suffering from a bowel obstruction is that when killed, the boomer explodes. Any survivors standing near the explosion are coated in bile, just as if they were hit by the boomer's primary attack. This explosion also has a substantial stumble effect, causing survivors to stumble backwards uncontrollably, and can be used by the boomer to knock survivors into environmental hazards, such as off the ledges on No Mercy. When someone's bowel gets obstructed, it begins to fill up with fluid as well as air that the person has swallowed. This increases the pressure inside the bowel. If that pressure builds up, the person's bowel can literally explode. This is called an intestinal perforation, and it requires emergency surgery to treat, or else the person will almost certainly die. So the boomer was likely a morbidly obese person producing significant amounts of bile and suffering from a bowel obstruction, resulting in projectile vomit of that bile and a massive explosive death when shot. The smoker is a tall, thin person with several tumorous growths around its head and neck. For its primary attack, the smoker shoots its long, whip-like tongue at a survivor, which it then uses to snare. After successfully snaring a survivor, the smoker then begins to reel them in like a fish, slowly pulling on its tongue in an attempt to get the survivor as close as possible. The first thing I notice about the smoker is its name. The smoker is someone who obviously smoked. Some sort of tobacco product, probably cigarettes. But the second thing I notice is the distinct sound the smoker emits. If you listen closely, the smoker is constantly coughing and wheezing. One of the consequences of a long time smoking tobacco cigarettes is the development of a condition called chronic obstructive pulmonary disease, or COPD. Cigarette smoking damages the airways of the lung, resulting in constant inflammation, scarring, and narrowing of those airways. This airway narrowing can cause people with COPD to create a wheezing noise when they breathe. The constant inflammation in the airways also generates a large amount of mucus, which is why people with COPD often have a constant productive cough that never really goes away. People with COPD are frequently admitted to the hospital when they have an exacerbation of their COPD. This exacerbation is usually due to some sort of respiratory infection like a respiratory virus. Whereas a healthy person can generally fight off a respiratory virus without additional help, a person with COPD often requires additional treatment to help them get through the viral infection. This treatment can include supplemental oxygen, medicine called bronchodilators, which help open up the narrowed airways, as well as steroids, which decrease the inflammation in those airways. If the exacerbation is very severe, the person may even need to be placed on a ventilator to help them breathe. Another terrible consequence of long-term cigarette smoking is cancer. Remember, the smoker has several large masses around its head and neck, and there's also the question of its bizarrely long tongue. It even appears to have a second tongue growing out of its head, as, I don't know, a backup tongue. While tobacco use is associated with an increased risk of almost every type of cancer, it specifically results in a type of cancer called head and neck cancer. Head and neck cancers result from the cells that line the surfaces of the mouth. So these include the cheeks, the lips, the tongue, etc. This might be why the smoker has such a long tongue. The tongue might actually be a cancerous growth. The large tumors around its head and neck may also represent some type of cancer. I think head and neck cancers are some of the most morbid cancers that a person can experience. This is because the head and neck and mouth are some of a person's most intimate areas. And when someone gets cancer in these areas, a lot of times they get a change in their appearance, right? If they have a large tumor that's pushing on their mouth or pushing their face in a certain direction. A lot of times people with these type of cancers also can't feed themselves because the cancer destroys their mouth area. It might block their mouth or their esophagus and really prevent them from even chewing food. So a lot of times people have to get a feeding tube inserted just so that they can maintain a level of nutrition. And I always feel so terrible when taking care of someone who has one of these type of cancers just because of how morbid and miserable it is. The charger has an oversized figure with large feet, a large skull, and one massively oversized arm. It's one of the most resilient of the special infected, with a hit point pool second only to the tank. As its name implies, the charger attacks by running straight at the survivors. He'll pick up the survivor. He'll then begin to slam the unfortunate survivor until he's either knocked off or the survivor dies. The charger is someone who suffered from an overproduction of human growth hormone. Human growth hormone is a hormone that's secreted from the anterior pituitary gland, a pea-sized gland that dangles from the front of the brain. Human growth hormone is responsible for a variety of effects that help build up the human body. It includes gaining weight, increasing muscle mass, and retaining calcium to help with the mineralization of bone. The effect of excess human growth hormone on a person's body will depend on the age at which that person was exposed to the excess hormone. Gigantism is a condition that occurs when a person is exposed to an excess of human growth hormone in childhood. When the exposure occurs in adulthood, it results in a condition called acromegaly. The reason for this difference is because of the way our bones form. Bones form using what's called a growth plate. Growth plates are a zone of constant bone formation, and they exist at the ends of the long bones, such as the femur, the tibia, and the humerus. A child has very active growth plates, and so when they're exposed to excess human growth hormone, their long bones grow much longer than they would normally. This results in the significant height that you see in people with gigantism. An adult, however, doesn't have the highly active growth plates that a child has, and so when they're exposed to excess growth hormone, they don't get a significant lengthening of their long bones. Instead, they get a thickening of certain bones in the body, in particular the skull, the jaw, the feet, and the hand. And this is exactly how the charger looks. It has a very large skull, a thick brow, as well as very large hands and feet. It may be that the charger was an adult who was exposed to human growth hormone because they were suffering from a pituitary tumor, which is the most common way adults are exposed to excess human growth hormone. This resulted in the condition acromegaly. Next up is the hunter. Of all the special infected, the hunter is the one that appears the least visibly mutated. It appears very similar to the common infected, just wearing a hoodie and with some duct tape wrapped around its arms and legs. However, the hunter's attack reveals that it's definitely not another one of the common infected. The hunter goes into a crouch position and is then able to leap great distances through the air to pounce onto a survivor. From there, the hunter pins the survivor and deals continuous damage with its claw attacks until it's either knocked off or the survivor dies. I don't have too much to say from a medical perspective about the hunter, because it doesn't seem like the hunter was someone who was suffering from any particular medical disease. In fact, the hunter was probably someone who was in great health and was very athletic. The way the hunter leaps through the air and bounces off walls reminds me of someone who practices the sport parkour. And parkour is definitely a sport that requires great strength, stamina, and overall athleticism. I will say though that of all the special infected in Left 4 Dead, the hunter was my favorite class to play. I love the feeling of climbing up to a high point and just landing a maximum damage pounce on a survivor. It just felt so satisfying to really line that attack up and have it land. The Jockey has a very short figure and stands in a sort of hunched over pose. It's also very quick and capable of leaping high into the air, and it uses this leap to position itself to deliver its primary attack. The Jockey leaps onto a survivor and then wraps its arms and legs around them. From this position, the Jockey is able to steer the survivor wherever it pleases, which can be into environmental hazards, zombie hordes, or into the attacks of the other special infected. I think the most distinct feature of the Jockey is its hunched over pose. Our vertebral column, more commonly called the spine, is actually dozens of bones stacked on top of each other. Each of these bones is called a vertebra, and between each bone is a disc. As the discs begin to wear out, the spine begins to arch forward into a position that's called kyphosis. When this kyphosis is extreme, it's called hyperkyphosis. And it looks like the person is bending over or that they have a hunchback. This kyphosis is pretty common to see in more elderly people, and the Jockey's appearance also hints that the person who became the Jockey was a more elderly person. You'll notice that the Jockey's hands are constantly twitching and tremoring. Certain neurological conditions, most notably Parkinson's disease, feature tremoring as one of their symptoms. Another possibility is that its tremor is a type of tremor called essential tremor. Essential tremor is a tremor that someone can experience when they're going to perform some sort of action. So a person who reaches for a glass or tries to grab something won't experience the tremor until they initiate that action. So they won't have any tremor when they're just resting and not moving, but the moment they go to reach and pick up that glass, that's when they start to have the tremor. So the Jockey's kyphotic posture, its receding hairline, and tremors make me think that the Jockey was someone who was an older person experiencing sort of the normal conditions we see in aging when they contracted the green flu virus. A spitter is a tall, lanky woman with pigtails and a large belly. She attacks by spitting a large ball of acid, and this ball of acid then forms a large pool of acid when it hits the ground. Any survivors caught standing in this pool of acid rapidly take large amounts of damage. When the spitter dies, she also leaves behind a smaller but equally damaging pool of acid. The spitter's attack can be especially damaging when the survivors are caught in cramped conditions where they don't have much room to maneuver, or when they're pinned in place by the attacks of the other special infected, such as the hunter or the Jockey. What stands out to me about the spitter is the fact that she seems to use acid as her weapon. In order to digest food, human beings produce hydrochloric acid in their stomach. This hydrochloric acid is produced by a special type of cell in the stomach called the parietal cell in response to a hormone called gastrin. However, there are certain conditions that can affect the amount of hydrochloric acid produced by the cells in the stomach. One of the most common conditions is when the cells of the stomach become infected with a bacteria called H. pylori. H. pylori is a corkscrew-shaped bacteria that embeds itself into the stomach wall and can affect the production of stomach acid. So an H. pylori infection can cause a person to either not produce enough hydrochloric acid or actually cause them to produce too much hydrochloric acid. The spitter's primary attack being a large ball of acid makes me think that she was probably someone who was suffering from an H. pylori infection. That H. pylori infection then resulted in an overproduction of stomach acid, and when she became a spitter, she then uses that acid as her primary attack. So aside from the acid production, the second thing that stands out to me about the spitter is that she seems to be able to spit the acid a very great distance. So normally stomach acid is prevented from leaving the stomach and entering the esophagus by something called a sphincter. So the sphincter that separates the stomach from the esophagus is called the lower esophageal sphincter. And sometimes the lower esophageal sphincter can become too loose. And if that happens, then stomach acid can then pass from the stomach into the esophagus. And this isn't something that you want to happen, and it's not something that normally should happen because the esophagus is not designed to resist the effects of stomach acid in the same way that the stomach is. It doesn't have the same protective layer of mucus that the stomach has. This condition is called gastroesophageal reflux disease, or GERD for short. It's more commonly called heartburn, and it's a very common condition that many people have probably heard of. They probably know someone who has GERD. Maybe, they themselves even experience symptoms of heartburn. And it's called heartburn because feeling as if there's something burning in their chest. And being in the chest, right away people associate that with their heart, thus resulting in the name heartburn. It's managed by taking medications that shut down the production of acid in the stomach, such as proton pump inhibitors like omeprazole. However, certain non-pharmacologic interventions have also been shown to improve the symptoms of GERD, such as weight loss, as well as reducing the intake of certain foods, in particular foods that contain caffeine, since caffeine is known to loosen or relax the muscles that form the esophageal sphincter. So the fact that the spitter is able to shoot this acid a very far distance means that she probably was someone who is suffering from an H. pylori infection, resulting in overproduction of gastric acid, and the relaxation of the esophageal sphincter from GERD then allowed that acid to pass out of the stomach and allowed her to shoot it the great distances that she was able to. The witch is found either sitting on the ground or meandering slowly around, with her face in her hands, continuously sobbing. Unlike other special infected, the witch will not attack the survivors on sight. In fact, she seems so dejected and sad, she really doesn't pay attention to them at all, as long as they are careful to walk around her and not make too much noise. However, if they get too close, shoot her, or even shine their flashlights on her for too long, she becomes enraged and rushes at them. She'll then instantly incapacitate and rapidly slash at a survivor, causing a tremendous amount of damage in a short period of time. The witch is a bit different from the other special infected, since it seems like the diseases she suffered from were more psychological in nature as opposed to being just physical. So right away, the first thing that stands out to me about the witch is that she has a very thin, almost malnourished appearance. We would call this someone who's emaciated, so meaning that they're severely underweight. This leads me to suspect that she was someone who suffered from some sort of eating disorder, such as anorexia nervosa or bulimia. Anorexia nervosa is a condition in which a person believes that they're overweight even though they may be a completely normal weight or even underweight. As a result, a person with anorexia will try to starve themselves in an attempt to achieve what they perceive to be an ideal body weight. I don't think anorexia was the only disorder that the witch suffered from, because I don't think anorexia alone really explains her behaviors. And I suspect that she suffered from some other a psychological disorder alongside anorexia. And that would make sense because psychological disorders often co-occur with each other, meaning people often have multiple disorders. If they have one, they tend to have another one as well. There's a few disorders that I think explain the witch's behavior pretty well. The first of those is bipolar disorder. Bipolar disorder is a condition in which a person's mood fluctuates between periods of depression and periods of mania. So remember, when the survivors first encounter a witch, she appears sad and sullen, and she really doesn't move very much. And I think that this sort of sad, somber state could represent her being in a depressive mood. So someone with depression experiences feelings of sadness, difficulty concentration, and they can also find it difficult to just move physically. So someone who's suffering from depression may just feel like they can't do anything. They physically can't move their body. A manic episode, by contrast, is characterized by high amounts of energy and enthusiasm. People experiencing a manic episode come up with all sorts of large ideas, business plans. They may spend large amounts of money trying to make those ideas a reality. Bipolar disorder can also have a subtype that features psychosis. Psychosis symptoms include hallucinations, which are often auditory in nature, meaning someone can hear voices or hear sounds that aren't there, as well as fixed delusions, which are beliefs about reality that are not true. The witch, whose mood seems to flip between slow depressive episodes and high energy manic episodes, makes me think that she may have been someone who suffered from bipolar disorder, possibly with psychotic features. Another possibility to explain the witch's behavior is a condition called borderline personality disorder. Borderline personality disorder is characterized by emotional extremes, impulsivity, as well as the tendency to view the world in black and white terms, meaning people with borderline tend to view people and situations as being all bad or all good. There's no in between, there's no gray zone. So someone suffering from borderline personality disorder may really love someone. In one moment, they may think that they're the greatest person ever, the greatest person in the entire world, and then that person can say or do something, and the person with BPD can then flip and go the complete opposite extreme and now think that that person is the worst person in the entire world and that there's nothing good about them at all. So the fact that the witch seems to snap and attack the first survivor who disturbs her, even if it was by accident, makes me think that maybe she suffered from borderline personality disorder. So the final special infected is the tank. And the tank is the largest and most powerful of the special infected. Tank often appears during finale events as a final challenge that the survivors have to overcome in order to escape from that particular area. So the tank appears to have a massive upper torso with massive muscle hypertrophy, meaning that his muscles are very, very large. They're overgrown. They're much larger than you would expect on a normal human being. And as a result of having that much muscle on them, the tank doesn't appear to be particularly fast. In fact, the tank is actually quite slow, and the survivors are able to outrun the tank as long as they're careful. If the tank does catch up to a survivor, he'll attack using his massive fists. And the attack is so powerful that it can even send the survivor flying through the air and off the stage if they're not careful. The tank is also capable of doing a ranged attack in which he reaches down to the ground and chucks a massive chunk of earth at the survivors like the Beast Titan. So the tank appears to be someone who did a significant amount of weightlifting prior to his zombification, although it appears that he always skipped leg day. And not only did he do a significant amount of weightlifting, but just the the overall mass on his body makes me think that he probably did anabolic steroids. Anabolic steroids are a class of drug that work by activating the body's androgen receptor. This results in a significant growth of muscle tissue known as hypertrophy. However, long-term anabolic steroid use has been theorized to lead to several undesirable conditions, most notably hypertrophy of the heart. So the heart is basically a giant muscle, and you might think that hypertrophy of the heart is a good thing. If you have a larger heart, it must be better at pumping blood. That sounds like a good thing. However, this is not the case. The reason is because in order to pump blood effectively, the heart has to first fill up with blood. If the heart is very stiff, because it's so muscular, it's actually unable to fill itself up with blood. And if it can't fill itself up with blood, then there's no blood to pump forward. You have to first fill up the chambers of the heart in order for it to pump blood forward. When the heart is unable to fill itself up with blood, we call that diastolic dysfunction. This is because the phase of the cardiac cycle in which the heart fills up with blood is called diastole. You can contrast this to systolic dysfunction, which is when the heart is too weak to pump blood forward. The tank may be suffering from hypertrophy of the heart, resulting in his decreased speed and stamina as compared to the other types of infected. Even with this weakness, the tank is still the single most dangerous and powerful special infected, and it requires the coordination of an entire team of survivors in order to take down. If the survivors aren't able to work together, one tank can easily bring destruction to an entire group. So thanks for watching this video. I think Left 4 Dead is an amazing game. I really had a ton of fun playing it as a kid. And I still think it's amazing that it has a strong fan base even to this day. I think it's something like 26 years after the game was first released. It just shows just how good this game really was. So again, yeah, thanks for watching. Take care.